Hey guys, Chandler here, back on my channel Alternate Journey, and yes, I finally dyed my hair, and finally back with another video. Last week, I didn't post because I just wasn't mentally there to really post a video. I know I was pretty good for a while, posting a video every week, sometimes even 2 videos a week, which I do. I want to become on a consistent schedule for you guys, because I do enjoy making videos. I like how you guys really like the content that I'm putting out right now, which is awesome and great, but sometimes it's just dysphoria gets in the way, or I'm just really tired from my job, so it's just yeah, I hope you guys know I still do care, obviously. So yeah, anyways, in today's video I'm going to be talking about how to reduce shot anxiety. This is something that a lot of trans and non-binary individuals go through when they start hormone replacement therapy. Because it is a nerve-wracking thing. It is something that a lot of people actually just have the fear of needles in itself. Just to let you know, there's other ways of getting testosterone and estrogen, of course, depending on what your transition is. I know with testosterone, there's patches and gels that you can try. I believe with estrogen, there's actual pills. I'm not exactly sure other methods of it, but I know there's just more than just doing shots. There are other options if you really cannot get yourself to do shots. I completely understand. I sympathize with you. At first, I couldn't really do my shots either because of my anxiety, but I forced myself to because it's just it costs a lot of money to go to the doctors and have them do it. It's better off either switching to a different type of way to get your hormone replacement therapy, or to just learn ways to reduce your anxiety in order to do your shot. So here I am giving you guys a little bit of tips and advice on that. First off, focus on the goal. You're doing hormone replacement therapy for a reasoning. You're doing it to become the person that you always were meant to be and to relieve your dysphoria. To focus on the goal, make a picture in your mind of the future you. So I'm talking from the trans man aspect because I am a trans man, so that's what I can relate to. Just picture yourself with a bunch of facial hair, if you want facial hair. Just think of yourself as that man that you were always supposed to be. I always think about how much I'm going to enjoy facial hair and how much I'm going to look good with a good 5 o'clock shadow or a good goatee or something. And I always thought since the beginning how much more confident I would be with my voice. Now being over a year on T, my voice, I passed extremely well with it, and I just know it's going to get better. I'm going to get more confident with it throughout time, because throughout the next couple of years my voice, it will continue to slowly drop. Use a shorter needle. Most people, they have a lot of anxiety doing their shot because they see that big needle. Most doctors actually suggest doing 1.5 inch needle. Personally, I don't use 1.5 inch because it just seems so big, and I had a fear, I had this irrational fear that I was gonna stab and hit my bone. Just because I am kind of a thin guy, but it's I don't know, if you're thicker, then yes, you can use 1.5. But I just use 1 inch. That's gonna get right into the muscle. You'll be completely fine. It's not too short, not too long, and actually some doctors suggest 1 inch anyways too. So it depends on your doctor. It depends what you're comfortable with. Or you could just switch to subcutaneous shots. These are extremely smaller needles, basically the size that people use for insulin if they're diabetic. So basically subcutaneous shots, basically you would inject either a 45-degree angle in your thigh, or honestly most people just choose their stomach because there is a lot more fat in their stomach and it's just easier, honestly. Don't stab. I know that's kind of obvious and that sounds more of a pain tip than anxiety tip, but with some individuals, when they have anxiety and they just want to do their shot, they're just gonna try to do it as quick as possible, which can be dangerous on your end. Please do not just stab into the muscle, because your muscle's gonna tighten a lot more because it's gonna react to stabbing it. Also, you're gonna probably bleed and just no, don't. There's gonna be so much more negative side effects from doing that. I know you just want to kind of do your shot really fast and try to inject the testosterone so fast, but remember, testosterone is an oil, and oil is thicker than water, so of course the shot is gonna feel forever long when you're injecting it. Just know it is actually going as fast as it can. Do not try to press really hard, because when you're pressing really hard trying to inject the testosterone, you might shake a little bit and the needle will move around, and it's just it'll cause more scar tissue, which means that it would be harder for you to inject later on in life, and you might have to stop taking testosterone shots and might have to switch to something else. Just gently place the tip of the needle onto your thigh and slowly apply force. It's the simplest, easiest way to do it, and also your muscle won't tighten. Take a deep breath, and as you're injecting in, release the breath. to help with their anxiety. Create a calm environment when you're doing your shot. This is honestly like a really like self-care routine, honestly, when you're doing hormone replacement therapy, because you're creating yourself and everything. You're creating the person that you always meant to be, and that's what self-care is, kind of. It's like taking care of yourself, and that's what you're doing with doing your shots and everything. You're taking care of yourself, mentally, physically, just everything. And so basically just create a calm environment, do things to get yourself into that relaxed self-care mindset. Take a shower, take a hot bath, listen to music when you're getting your dose ready, or light some candles or incense. Honestly, for me in the beginning, I used to just put on Grateful Dead music, light some incense, and yeah. Now I really don't have to. I just take my shower, because I do my shot at the end of the day after I get home from both my jobs. I take my shower and then just do my shot. I don't really have to think about it anymore, because like I'm over a year on T, so it's just like also doing weekly, every Wednesday doing a shot. You just get so used to it, and it's just like, yeah. Give yourself time. When you give yourself time, you allow yourself to become more relaxed. Definitely do not try to do your shot before you have to go somewhere. At least give yourself a 15-minute window to do your testosterone shot. Usually it takes like 5 minutes for me, honestly, to do my shot, but it's just like, give yourself 15 minutes, so it gives yourself extra time. But I honestly suggest don't rush yourself with doing your shot, and don't like schedule it before you have to go out and do something, because that, like, even if you give yourself a 15-minute window, like I'm still like an anxious person about being on time and stuff, and then adding on to like doing a shot that you're not so sure that's gonna like, you're like able to do, that's just too much stress and too much anxiety. Like you're just producing way too much anxiety, and it's like, it's not gonna work out. But you can always come back and do the shot later. So like, say you want to be that person that like eats breakfast and then do your shot, but like for some reason like you have so much anxiety, you just can't do it, the needle won't go in, you're tensing up too much. That's fine, just put the syringe down and go back to it later. Just remember to change the needle though, because like obviously you dirtied the needle and stuff. But like, you can always come back later. And if you miss your shot day, it's not the end of the world. You're not going to be completely off track. So basically, if your shot day was Tuesdays, but you missed your shot because too much anxiety, or you didn't have too much time, or you totally forgot about it, just try the next day, and then there you go, your new shot day will be Wednesday. That honestly happened to me. My shot day used to be Tuesday when I first started testosterone, but like I had so much anxiety that I literally could not do my shot. Like I tried 3 times and I couldn't do it, so I just gave up. I just did it the next day whenever I felt like doing it. That's the key when it comes to me. Like even if like I do it typically at the end of the day, but like if I randomly just feel like doing my shot, do it. Don't let that be like, oh, I gotta do it at the same exact time every day. That is a lie. I know some people who like literally set a timer on their phone, say like 12:15 p.m. every Wednesday, I gotta do my shot. No, just do it the same day. It doesn't matter when, what time, morning, afternoon, night. It doesn't really matter. As long as you do it within that day, you're totally fine. It's not going to screw up anything. It's not like you're going to do an overdose. It's not like you're going to have symptoms right away from low testosterone. It's just do it within that day. That's all you got to do. So whenever that feeling of, I just want to do my testosterone shot, take advantage of that feeling and do it, because you're obviously less anxious in that time frame, because you're thinking about doing your shot, because you know you have to do it, and you're like, might as well do it now. And last but not least, my last advice is associate shot day with another reward. Obviously, hormone replacement therapy is a reward in itself. You're finally on testosterone or estrogen, and you're starting to see changes that you've always were like meant to be there and everything, and you're just like becoming more yourself and more confident, which is amazing. Doing the reward kind of program will create a positive feeling, as cheesy as that sounds and everything, but like it will encourage you more to do your shot. So say you're an individual that like tries to eat clean, but you allow yourself like one cheat meal, then on your shot day, have your cheat meal. But do not give yourself the reward until after you do the shot. So for me, I try to eat clean. I mean, like sometimes I'm really busy, so like I just do like the quickest, easiest thing. But for the most part, I do eat clean. I do cook a lot for myself. So my reward is like the most like unhealthiest dessert of the week. I'll do after I do my testosterone shot, because like it's already nighttime. It's like I do it before bed. So it's like, yeah. Overall, don't overthink it. If you overthink it, you're gonna just create more anxiety. I used to overthink doing my shots in the beginning because I used to be extremely afraid of blood, and like I was always afraid like I was gonna do the shot wrong and just bleed everywhere, which I haven't. I've been doing my own shots for over a year now, and like nothing has gone wrong. But like for the first couple of months, I've always like had this image in my mind of like blood was just gonna fill the syringe, and like I was gonna like take out the needle and blood was just gonna pour everywhere because like I accidentally like stabbed a blood vessel or something. Because that's what you're supposed to do as soon as you, not stab a blood vessel, but like you're supposed to, when you inject the needle, you're supposed to pull the syringe back a little bit to see if any blood comes into the syringe, because that just shows you that like you accidentally stabbed in the wrong like spot or something. You like hit a blood vessel. That's why you like look for veins before you do your shot. I actually made a video of how I do my testosterone shots, so check that out if you want. I actually talked through it too. But it's like, so if it does happen, you take it out, you throw that dose away. Unfortunately, you compromised that shot or whatever, so like you would have to try on the next thigh, which that's never ever happened to me. But like that was my biggest fear, and that's how much like I would like just keep on thinking about it, and like so much I would just like increase my anxiety because of that fear. So just don't overthink it. And the main reasoning of why you have anxiety to do your shot is because you're afraid of pain or afraid of doing it wrong. I highly suggest that you go watch my other video where I discuss on how to make your hormone replacement therapy shots less painful. Anyways, that's all I have for you guys today. I hope that you found this video somewhat helpful, and if you have other tips and advice, please comment that down below for other individuals to see and to educate myself a little bit more on the topic as well. Please like and comment, and definitely subscribe if you are new. And don't forget to push that bell down below so you can get notifications whenever I upload a video. That is if YouTube will actually show you the notification. And yeah, I make videos whenever I can, but you can always expect important updates on my transition. Alright, see ya.